Hello everyone. Now I'll discuss about the gross features of prostate. In this section, I'll be talking about the anatomical divisions of prostate, its relations, prostatic venous plexus, and benign prostatic hyperplasia. Coming to the sagittal view of this male pelvis, we're saying this is the anterior aspect, this is the posterior aspect. Here, this is the pubic symphysis. Posteriorly, you can see this is the rectum. Here, you can see this is the anal canal. This superiorly, this is the urinary bladder. See, this is the prostate. You can see this is the prostate. Then this part is the urogenital diaphragm, which supports this prostate. This is the part of the penis. So prostate is a fibromuscular glandular structure, is an inverted cone shape. So this is the apex. This forms the base. Here, this is the base which relates to this neck of the bladder. This part is the apex, which relates to this urogenital diaphragm, which supports this prostate. Then can see this the anterior aspect. So this surface, this is the anterior surface. This is the posterior surface, relates to posteriorly. Okay, this is the anterior surface, this is the posterior surface. This one is the base, this part is the apex. So in this coronal view, see this is the urinary bladder. This is the part of the penis. This is the prostate. The surface here, this is the lateral surface. It relates to one muscle there, besides that is the levator muscle. Levator muscle. Okay, so that's about the features of this prostate. And also it is traversed by this urethra. See, this is the urethra. This is the prostatic urethra. Here we'll get, this is the membranous urethra. This is the spongy urethra through this penis. Then this is the posterior view. Posterior view. Here we can see this is the urinary bladder. Okay, view of the prostate from behind. This is the posterior, this is the prostate. So this is the posterior surface of the prostate. See here, this is the base of the bladder. There you can see the vas difference or ductus difference of the seminal vesicle. The seminal vesicle is a tubular glandular structure, okay, which joins with this vas difference, forming this ejaculatory ducts, which opens into the prostatic part of urethra. Okay, so this is the anterior of this bladder, the posterior that forms the base of this bladder. Then this is the prostate. See, this is also the posterior view of the prostate, view from behind. See, this is the bladder, urinary bladder. Here you can see this is the prostate. Prostate, the surface is the posterior surface. See, this is the rectum. That is the rectum. See, this is the ductus difference. This is the seminal vesicle. So it lies in the lesser pelvis. Its dimensions, its vertical diameter, this vertical diameter is 3 centimeter. Its transverse diameter, that is 4 centimeter. Then anteroposterior, anterior to posterior, that is 2 centimeter. Then here you can see this the lobes of the prostate. See, first is the sagittal view, is traversed by this urethra. Then ejaculatory duct is there, ejaculatory ducts. The part of this prostate here anteriorly, this posterior, anteriorly, that forms, this is the anterior lobe, that is in green color. The lobe which lies above this ejaculatory duct, that pink area, that forms the median lobe, that forms the median lobe. The part below the ejaculatory ducts, behind this prostatic urethra, that forms the posterior lobe. In the transverse section, this is the prostatic urethra. Center you can see the prostatic urethra. In front, this is the anterior lobe. Then there is a median lobe behind this urethra. Posterior most, there is the posterior lobe. And each sides will get, these forms the lateral lobes. That is the lateral lobes. Then coming back to this first figure, here this is the anterior, this is the posterior. Okay, so this is the anterior lobe. Here you can see this is the ejaculatory duct opens into this prostatic urethra. Then there you can see there is a diverticulum of this prostatic urethra, that is called the prostatic utricle there. That is the prostatic utricle, this diverticulum here. Then this lobe, this is the median lobe. This one below this ejaculatory duct, that forms the posterior lobe. Then in this coronal view, see these are the lateral lobes, that forms the lateral lobes. Yes. Coming to this prostatic urethra, you can see the openings of the prostatic utricle, then the ejaculatory ducts can see. So this is the coronal view, urinary bladder. See the prostate part of the penis. Here, this is the urethra. This was the urethra. This is this part that forms the prostatic urethra. There you can see a mucosal ridge there. Okay. This is the internal urethral orifice. This opening here, urethra starts. This is the internal urethral orifice. This mucosal ridge that forms the urethral crust, this one. Then there is a mucosal elevation there, that is the seminal collicles. There you can see the opening of the prostatic utricle. Then in front there is the opening of this ejaculatory ducts. You can see either sides, two ejaculatory ducts opens. The space here on each sides of this urethral crust, this seminal collicles, this region, that is the prostatic sinus. There you can see the opening of the prostatic glands. So this prostatic glands, these are compound tubuloalveolar glands of 30 to 50 in number. These secretes proteolytic enzymes through the ducts. It opens into the sinus of this prostate. Okay, sinus, which you can see in the prostatic part of urethra. Okay, this is the prostatic sinus. That you can see the opening of the prostatic glands. Coming to the structure of this prostate. Here, so this glands are arranged in such a way that there is an innermost zone that is called the transitional zone. This is the anterior aspect. This is posterior. There you can see the vast difference with this seminal vesicle. This forms the ejaculatory ducts. So ejaculatory ducts opens into this prostatic urethra. See the prostatic urethra. So the innermost zone of the transitional zone can see surrounding this prostatic urethra. Then there is a part surrounding this ejaculatory ducts forming the central zone. The remaining forms the peripheral zone. The remaining area forms the peripheral zone. In the peripheral zone, you can see numerous glands. Numerous glands are there. In the anteriormost, this anteriormost part, that is fibromuscular. So the prostate in the transverse section, it's like this. This is the anterior aspect. The posterior aspect, this innermost zone, which is traversed by this prostatic urethra. So the hyperplasia starts from this innermost zone. Hyperplasia starts from the innermost zone. The carcinoma of the prostate starts from this peripheral zone. Peripheral zone. Here it relates to the posterior lobe. Innermost zone relates to the median lobe of the prostate. So during carcinoma, this longitudinal groove posteriorly, this longitudinal groove or furrow will lose this longitudinal groove or furrow. It becomes a nodular mass. Okay, and also in the hyperplasia, this longitudinal furrow remains intact. This longitudinal furrow remains intact. Okay, and the carcinoma will lose that furrow. Okay, so during the rectal digital examination, one can palpate this prostate, the posterior aspect, and can this furrow also can palpate, can differentiate the condition of this prostatic cancer and the prostatic hyperplasia. Prostatic hyperplasia starts from this innermost zone. that is the transitional zone. This carcinoma starts from this peripheral zone. Then here you can see the relations of this prostate. This is the sagittal view of the male pelvis: anterior, posterior, sacrum, coccyx, pubic symphysis, bladder can see. See, this is the seminal vesicle, the ejaculatory ducts. This is the prostate. This is the anteriorly relates to the space there behind this pubic symphysis. This is the retropubic space, or the space of rectus. See the posteriorly. Here this is the rectum. This is the ampulla of the rectum. Posteriorly relates to the rectal ampulla. Here this is the peritoneal fold will be there. This is the rectovesical pouch. In the beginning, this rectovesical pouch extends till the level of the prostate. Then it obliterates and forms a fascia there. That is the fascia of Denon villus. This fascia, this posterior fascia of this Denon villus, which act as a barrier of the spread of this prostatic carcinoma into this rectum. Okay. Then superiorly, the prostate, see the prostate superiorly relates to this bladder. Inferiorly, it relates to this urogenital diaphragm. So anteriorly, there is the space of rectus. Posteriorly, there is the fascia of Denon villus. Okay. Then here coming to the blood supply, the arteries supplying are, here you can see this is the inferior vesical artery. It's a branch from this internal iliac artery. Here you can see this is the branches from this middle rectal and the internal pudendal arteries. Okay, these are the branches from the internal iliac artery. Then venous drainage into this prostatic veins drains into the internal iliac veins. Moreover, this is the coronal view. This is the urinary bladder. Urogenital diaphragm. See the prostate. Prostate is there. Okay. There is a coverings. Okay. You can see the coverings are the false capsule and true capsule is there. This true capsule, this is the condensation of the stroma of the gland. The false capsule, the outermost, that is the condensation of the pelvic fascia. Okay, this forms the coverings, false capsule and true capsule. In between this, you can see this is the numerous venous plexus there that forms the prostatic venous plexus. Here you can see the prostatic venous plexus. This prostatic venous plexus drains posteriorly into Batson's venous plexus, which finally drains into internal vertebral venous plexus. Okay, this internal vertebral venous plexus communicates with the basilar venous plexus of this cranial cavity. So any carcinoma, so cancer of this prostate can spread to the internal vertebral venous plexus to this and also it reaches the cranial cavity. So it can produce secondaries in the vertebra and also can spread to this cranial cavity. So that's about this prostatic venous plexus. Then coming to this benign prostatic hyperplasia. So here, this is the first image, sagittal view. You can see this the normal prostate. It's in the normal size. Its average weight is 8 grams. Okay. It's average. This is the anterior. This is the pubic symphysis, rectum. This is the anal orifice. Okay. Here it lies through the anal 4 centimeter above. Can feel the prostate. Then here it's traversed by this urethra can see. Here in the second one, there is the enlargement of this prostate can see. It's due to this hyperplasia. So usually this before puberty, it's the size of a peanut. Then it doubles its size after puberty. Increase this glandular part and this fibromuscular part and all. Then after 45, it regresses. Okay. or either it regresses or it hypertrophies. If hypertrophies, that condition is called the benign prostatic hyperplasia after age of 45. So during hyperplasia, this it compresses this one. See, this is the enlarged prostate. It compresses the urethra and presses upon this bladder, producing weakness, and this bladder wall becomes thicker and may get weakens, forming the urinary retention. Okay, that means the bladder won't empty the urine fully. There will be the retention of the urine, and such patients complaints of this urinary retention, dysuria, and nocturia and all. So in prostatic hyperplasia, the prostate enlarges and presses the urethra, forming this urinary retention. Maybe this urinary retention. There is narrowing of this urethra. Will be there. Narrowing of this urethra. So this benign hyperplasia starts from this innermost zone, and prostatic cancer starts from the peripheral zone. That's all about the prostate. Here a case that is a 55-year-old male complained of difficulty in passing urine. The more he strains during micturition, less amount of urine he passes. He also complains of retention of urine. So what is the possible diagnosis? How do you diagnose this? What is the removal of organ called? So what is the possible diagnosis? It is the possible diagnosis. It's a benign prostatic hyperplasia. How do you diagnose? That is mainly through this rectal digital examination. One can palpate the prostate, and also it gets confirmed by this MRA or this prostatic MRA or this ultrasound. What is the removal of organ called? It is the prostatectomy. That's all. Thank you.